we are continuing to discuss the big game changers in health in the last 75 years. We are joined by Suchitra Ella, co-founder and joint managing director, Bharat Biotech, Padma Bhushan awardee. And continuing with us, we have Dr. Chandrakant Panda, founding member, International Council for Control of Iodine Deficiency Disorders, Padma Shri awardee, and Dr. Dilip Mavalankar, director, Indian Institute of Public Health, Gandhinagar. Mr. Bachchan, would you have a question to ask Ms. Ella?
I just wanted to ask Suchitra ji, there was a great effort that went into making these vaccines, particularly for children, and how important it became for immunizing kids, despite the fact that we never had this vaccine earlier on. Yes. And after many attempts, and how wonderful to see that somebody in India was able to do that.
Bachchan ji and all the eminent panelists on the panel, a very good morning to you. Namaskar. India has been a forerunner in vaccinating her own children in the past several decades. We have started off with polio, and several other vaccines have come into play into the universal immunization program that is run under the Government of India, Ministry of Health, which continues to serve the entire nation across all states under the public healthcare system. India's vaccine prowess has been there because the public institutes existed in India in places like even Himachal Pradesh and Kasoli and in Kunnur in Tamil Nadu. There were the previous generation of vaccines, though in smaller doses and volumes and quantities, were manufactured in India. But when our population grew beyond the levels of where we are, the 1 billion plus, the second generation vaccines had to be deployed in order to bring about large scale manufacturing. We ourselves, Bharat Biotech today has been 25. We came to India, back to India when India was 50 from the United States. Krishna and I, our first generation entrepreneurs, chose to return to India in order to set up a life sciences and a vaccine and a biotechnology company, which was based on research, development, and innovation, and creating IPR for the country and thereby manufacturing new vaccines for our children and adults at large. Because indigenous vaccines bring competitiveness to the scale at which we have to manufacture. The vaccines available in the rest of the world, especially in the Western world, are very expensive for countries like ours, especially the developing countries. Though now I do agree, I don't want to call India a developing country anymore, but we are the fifth largest economic powerhouse in the world and rising so. But still, 25 years ago, or 2 decades back, or 10 years to 1 decade back, we still had this huge challenge. So competitiveness is important, scale is important, quality is of course important because we have to play with international quality norms that exist from the WHO and other international agencies. So India's vaccines have been the engagement for us right from the start as a new generation company, entrepreneurs. We have stood for innovation. We have stood for development of products. We have stood for creating new vaccines. And that's how came rotavirus. Amitabh ji and Pranav Roy ji, all of you would remember, India became the third country in the world, and rotavirus vaccine was the first vaccine fully developed under an Indo-US partnership program, which was existing prior and then was funded by large funding agencies from around the world, such as the Gates Foundation. And both the governments facilitated, the Indian government and the US government facilitated this growth, this development process of this vaccine. Thereby, we stand today as the third country in the world to make a rotavirus vaccine. We were losing 200,000 children to the rotavirus infection alone because of our lack of hygiene and lack of health systems in the deeper pockets of our country, and this because it led to serious dehydration and death in the children. So this is now slowly getting reversed because we have our own indigenously made vaccines. So rotavirus has set the stage for us, especially in the year 2015, when the Honorable Prime Minister launched the vaccine and announced it to the country and to the world at large that India becomes the third developer and manufacturer of a rotavirus vaccine. So it's extremely important that these vaccines, which are very important in the preventive days and the formative years of the children, the children have to be protected. Viruses such as these are extremely, as we all know, are extremely I would say dangerous, and the mortality rate is extremely high in many of them. The rabies vaccine, the rotavirus vaccine, the hepatitis B vaccine, and of late the Covaxin, which has also come into play, which we were absolutely unprepared as a world to tackle this pandemic of this size at this point of time. But I think as vaccine manufacturers, we have stood up to the call of the nation, to the call of our people, and to enable that our own vaccines be deployed. We partnered with the Indian Council of Medical Research in order to get the strains, because we needed the SARS-CoV-19 strains from a government, from a laboratory, which is the National Institute of Virology in Pune, that researches and does a lot of pioneering work in the field of viruses. So we reached out to the ICMR so we could get the live strains which were transported. This is a storybook kind of a story that I'm sharing with you today.
Suchitra ji, you see now with that heat and the focus and the strobe lights not on COVID as much as they were in 2020 and 2021, what is the role of the vaccine and the vaccination process now? It picked up, but where is it now and where does it need to go?
See, the country has, as we have all worked under a time pressure cooker kind of a situation it was. It's dreadful thinking of the last 2 years when we were developing the vaccine, when the strains came from, I stopped earlier by saying that the strains had to come by road from Pune because we were under the lockdown 1.0 and our own vehicles went and our own senior biotechnologists had to be sent along in the car. Imagine traveling to Pune from Hyderabad. I wouldn't be sitting here today in front of you, but for my colleagues in the entire team across 4 states. Our teams have been partnering and working and collaborating through this pandemic. Ignoring the pandemic conditions, the lockdown conditions that we were all under. After all, everybody's, everyone's life is precious, including the operator who has to go into our facilities and turn on the machines and the bioreactors that are there, where the virus cells are growing day in and day out as I speak to you. The vaccines that we have catered to in the country has crossed the 200 crore mark. We have completed the adult populations. The booster doses are going on. And this is where I go back to the point made by the earlier speaker, that the public and the community has to also understand the value of vaccination. Because in many a times, even in children's vaccination, we all know that our own children, our own grandchildren, we take them to the doctors, the pediatricians, where the booster dose is given, which is the 3rd dose. In some cases, there is also a 4th booster dose. But what I mean to say is the booster dose plays the most important role in completely, boosting that immune system that our our bodies and our immune system response that has to be built in our own individual systems, because we are all different. We do not follow, I don't think as a country we can take this chance by saying that, no, I took 2 doses and that's enough for me and I'm fine, I'm not infected again, I'm very hale, I'm healthy, I go to the gym and I have healthy lifestyle. All that is good. That will just add to our immune responses and the antibodies that need to be created in us. But I think that booster dose is important.
Yes, of course, Suchitra ji, sorry for interrupting. Absolutely. I think the points which you've made are absolutely important, and we need to build up our immunity. Prevention is definitely better than cure. Thank you all so much for joining us.